Hi, I'm Dr. Cassie from Vetfolio and the host of Vet2Vet. Today we're talking about diabetes, and I know I've personally had cases where helping clients successfully control this disease so their pets are able to live full and happy lives can be easier said than done. I mean, we're trying to work around owners' schedules, pets who maybe are finicky eaters, and whatever other hurdles are thrown at us to achieve successful management. And that can be just a lot to juggle. So I'm really excited to jump into this topic and discuss treatment options that are out there with one of the leading experts in the field, Dr. Cynthia Ward. Dr. Ward is currently a professor of small animal medicine at the University of Georgia and has been the chief of the small animal inpatient medicine section since 2007. So I'm excited to dig into this topic and discuss some of the great treatment options with one of the leading experts in the field, Dr. Ward. Thank you so much for being here with us today.
Well, thank you for having me. And if you're excited, I'm twice as excited as at getting the chance to talk about diabetes mellitus and hopefully help with some of the cases that might be giving you some trouble.
I will take all the help I can get. So I understand that there was a pretty interesting study regarding naturally occurring diabetes in dogs and the effects of once daily insulin. And Dr. Ward won't tell you this, but she's actually the lead author on this paper. So Dr. Ward, tell us a bit more about this study.
God, it was a really cool study. The thing that was a real landmark about this study is the largest field trial that's ever been done in dogs that have naturally occurring diabetes mellitus. And you know how usually we're looking at studies where there were, 10 dogs or 20 dogs. This study had 276 dogs that were treated for diabetes mellitus all across general practices in the United States. So it was a really landmark study. And it explored the possibility of being able to use once a day insulin, and the insulin that was explored was ProZinc insulin. The study was actually an amazing study design, which I can't take the credit for, but it was an amazing study design out of Boehringer Ingelheim. And they looked at equal numbers of, or pretty equal numbers of pre-treated dogs. So these were dogs that were diabetics. They're all naturally occurring diabetics. These are dogs that were diabetics that were pre-treated with insulin, another type of insulin, that were switched on to ProZinc once a day, and then naive dogs that were started on ProZinc once a day insulin. The other really cool thing about this study is that the success was defined in two ways. One was improving glycemic control, so some sort of a lab measurement of glucose. The other, though, was improvement in clinical signs. And as we all know, that's the real paramount thing that we have to fix with these diabetics. So the exciting thing that happened was all of these dogs, these 276 dogs, were treated with ProZinc insulin once a day, and 60% of them actually showed some success with therapy, or showed success with therapy. So that means that they had improvement in their glycemic parameters, including like blood glucose or fructosamine levels, but they also improved clinically. I want to emphasize that this study was done in dogs. It was not done in cats, and label recommendations for ProZinc recommend using it twice a day in cats. The other exciting thing about using the ProZinc once a day was that there weren't a lot of side effects that were noticed with doing that. And of course, we're seeing all the common side effects that you would see with using an insulin product, like lethargy and anorexia and some hypoglycemic events, but there wasn't anything out of the ordinary that you wouldn't be used to seeing with another insulin product.
That's super exciting because, scheduling and timing of injections can be a real challenge that we have to deal with when we're managing these guys.
It really is. And having a diabetic cat myself, I know how scary it is sometimes to make sure that you're home so that you can give these insulin injections to your pets.
Sure, absolutely. And, with 60%, it sounds like, maybe not everybody will respond to this, but it's worth a shot if we have a 60% chance of success. I guess my next question would be, how do we increase our odds of success? How do we pick the right patient who will respond to this protocol?
Yeah, and that's really important. And I think I don't have to convince the practitioner out there what a difficult disease diabetes can be to manage. And so we want to optimize everything as much as we possibly can. And certainly with using ProZinc once a day, you want to do that. So you want to stabilize your patient as much as you possibly can before you start insulin therapy. And so we want to make sure that if there's a comorbidity, we've addressed it and dealt with it and hopefully fixed it. We want to make sure that these animals are stable. They're not ketotic, they're not acidotic, they don't have histories of recurrent diabetic ketoacidosis or anything like that. We want to make sure that they're not hyperosmolar. We want to make sure that they're not hypoglycemic. So we want to have a stable patient, and you would want to do that before you started any diabetic on insulin therapy. So with all insulin products, we want to make sure that we really monitor the patients for hypoglycemia and hyperglycemia. And remember that it's really important to maintain and get to adequate glycemic control so that we prevent any sort of complications that these guys will have in response to their diabetes mellitus. And of course, I need to remind everybody that if you overdose this insulin, it can result in profound hypoglycemia and death. And you're right, you probably aren't going to get all of these guys, but with over 50%, like a 60% success rate with this insulin, it is definitely worth a try.
So if we decide to go to once a day dosing in these dogs, since it's a once daily protocol, is our starting dose higher than it would be with the twice daily protocols?
Yeah, it is. And I guess I'll just give one general reflection that I've had after, dealing with a lot of diabetics in practice. One of the big things that I see with veterinarians is they're afraid to use enough insulin. So I want to challenge everybody out there to not be afraid to use the insulin dose that you need. And in dogs and starting any insulin therapy, you want to give them at least half a unit per kilogram twice a day. Otherwise, you're going to start off too slowly. The owners are going to get frustrated. And we want to fix these guys and make them feel better as fast as we can. But with using ProZinc once a day, you need to go a little bit higher. So the recommended starting dose for a naive diabetic is about 0.7 units per kilogram. So it's going to be a little bit higher than what you might think. And in the study, that's what they started all the naive diabetics on. And honestly, that's what I do when I'm using any kind of once a day insulin. It's a pretty good starting dose for these diabetics. And if you have a dog, so many of the dogs in this study were actually already on another insulin, and you may have a dog that's on another insulin they're getting it twice a day, and you want to switch it to once a day. The label recommendations will say that you should transition to the mid to higher end of the dose, whatever you're comfortable with. But I would like to tell you that my rule of thumb is this: take 25% of the 24-hour, or I'm sorry, take the full 24-hour dose that you're giving. So if you're giving, let's say 5 units twice a day, that's 10 units once a day, and you decrease it by 25%. So that would be about 7 units once a day that you would end up using in a dog like that, or 8.5 units once a day that you'd end up using. And just do that. And that's a pretty safe way to transition from a BID insulin to an SID insulin. I will say that the study results showed a reasonably high dose of ProZinc insulin. So again, don't be scared. At the end of the study, with all the dogs that were on it, after they were stabilized, the mean daily dose was between 1.2 and 1.4 units per kilogram for the dog. So it's a little bit higher than you might think. So don't be frightened if you're getting up to that range with a once a day insulin.
Okay, I'm glad you said that because I don't know if you can see me raising my hand over here. You're like, vets don't start at a high enough dose. I'm like, yes, guilty. That's definitely me. And I want to go right down, after we are done with this video, what you said about taking the total 24-hour dose and decreasing that by 25%. And I really appreciate all the numbers and, kind of the protocols there, because it can be a little bit scary when you're up high on that insulin dose and don't have a lot of experience with this once a day. So that's good to know that by decreasing that total 24-hour dose by 25%, you're usually still in that safe range of dosing.
I have found it, I've been so lucky to get the chance to treat so many diabetics, and it's always worked well in my hands, and I haven't gotten in trouble with that kind of a dosing. So I think it's fairly safe. And I know it sounds scary, and I used to be scared about doing it too until I just got used it and got it in my hands and felt better about it. So I think you'll be okay.
Well, thank you for the reassurance. I know if there's anybody else like me out there, we really appreciate it. And I think you already answered this, but my next question was going to be, how do we switch them from twice a day insulin over to once daily ProZinc? And I think you gave us some really good guidelines there. Are there any other considerations we should keep in mind in that regard?
No, I think that the ones that you want to switch over, well, first of all, you don't want to take a really well-regulated dog in which the owner's not having any problems and change it. I mean, nobody wants to do that. So these are going to be dogs that are either not responding well to their insulin therapy, or the owners have some scheduling issues that they just can't manage twice a day therapy. And those are going to be the ones that you change. But I don't think I have to talk any of us into the fact that if you have something that's working really well and nobody's complaining about it, leave it alone.
If it ain't broke. We know it's not just insulin that controls these guys. I know I've definitely had the experience where, you know, owners maybe don't want to change everything, anything, or maybe I'm not making strong enough recommendations. And so we try to rely just on the insulin, and that doesn't always work. We don't always get good control there. Can you remind us of some of the ancillary things that help with diabetic control? I mean, it would be great if we could say, like, hey, just keep everything the same and we'll just add in this insulin injection. But of course, we know that's just not always the case.
It's really not, and it's unfortunate. But what I will say, and what I try to tell the owners of the patients that I deal with, is that if we can add in some of these ancillary things, it's going to make your pet respond better. In many ways, you can use a lower dose of insulin, and your animal will be better controlled, so you don't have to take them back and forth to the veterinary offices often. So you're going to save money, and the animal's going to feel so much better and so much less stressed. And there are absolutely some things you can do. So the first thing is calorie control. We know now that fat is an inflammatory organ, and any sort of inflammation that goes on in the body is going to interfere with the insulin that the owner's actually giving. So you're going to spend all this money to give an insulin shot, and then some of it's not going to work because you're in a high inflammatory state. What I've told owners to do is we like to feed the diabetics at least twice a day, even if they're only getting the insulin once a day. And in the ProZinc study, they did get fed twice a day. So we want to make sure we spread out their feeding. So one question that I get a lot is, what kind of a diet should I feed my diabetic dog? And the answer to that is a high insoluble fiber diet, as long as you're not feeding for any other type of disease. So for instance, if the dog's got inflammatory bowel disease or chronic kidney disease, you're going to want to feed diets that are specialized for that disease process. But if you are given free rein and the owner is willing to feed the animal any kind of a diet, a high insoluble fiber diet is the best, because it allows glucose to be absorbed slowly from the GI tract. And of course, we all love to feed our dogs snacks, right? They're so cute, and they want to be with us, and we want to give them snacks. And so one of the things that you can caution owners about is what type of snacks to pick. It's going to be impossible for owners not to give their pets snacks. So let's give them some guidance as to what some of the good ones are. So low calorie, low sugar, high in fiber snacks are great. Some examples of what people have used that have been very successful with diabetic dogs are things like frozen broccoli, frozen cauliflower. They don't have to be frozen, but dogs like that a lot sometimes. Green beans are great. Any kind of a high fiber, low sugar type of snack is wonderful. Things that you'll probably want to avoid are any sort of dog treats that have like high like propylene glycol in them, or any kind of sugar substances in them. And unfortunately, sometimes you have to read the package insert to get to that. So you want to make sure that you avoid things like that. Certainly like high sugar fruits or something that you might want to limit, because again, we don't want to be giving them straight glucose. We want to give them fiber, and we want to give them good complex carbohydrates. The third thing is exercise. And this is sort of new data that's coming out now. There's been a huge body of literature in humans about how important exercise is in diabetic control. And if you take two of the same size people with the same amount of fat that are diabetic and they eat the same thing, and one exercises and one does not, the one who exercises will have better glucose control. We have done some preliminary studies with this in dogs, and in fact, my residence paper just got published, which was very exciting. And so we've looked at this in dogs, and it does seem that they can handle a carbohydrate-rich diet better with some exercise. And by exercise, I'm not talking running a marathon. We put those dogs on a treadmill at level 1 for 15 minutes, and that's all we did. And in people, you walk on a treadmill at like level 3 or 4 for like a half an hour. So it's not a ton of exercise, but it can make a huge difference. So that's going to be the third thing that you could really add in there to help with your insulin control.
Gosh, it's so interesting, some of the data that's coming out with these diseases, of how much of it really comes down to diet and exercise.
Boy, that is for sure. I guess it's good for all of us. And the other thing is, now that fall's coming and the weather's nicer, maybe we should all be getting out and walking our dogs.
Yes, yes, absolutely. Good things for all of us to keep in mind right now. What about monitoring these patients? Do we need to make any changes to our monitoring, whether it's at-home glucoses or a Freestyle Libre or a glucose curve? What should we keep in mind when we're monitoring these guys?
So I think that the field of diabetes has changed so much since I started practicing veterinary medicine. We used to be very concerned about the daily blood glucose levels of our diabetic patients. And I think what we've learned over the last 15 to 20 years is that dogs do not have the same response to chronic hyperglycemia that people do. In people, they get vascular problems and kidney problems and retinal problems, and we just don't see that in our dog patients. So we've been able to then stand back and say, hey, you know what? What's the most important thing that I need to do for this diabetic? And basically, it's to treat its clinical signs. So we want to keep them clinically happy. We want them to stop drinking all the time and urinating all the time. We want to have them develop muscle growth. So one of the things that I will say is many people, or most people that are very interested in diabetes mellitus, are standing back and saying, hey, we've been over managing these guys. Sometimes we've driven owners to euthanasia because we've asked them to monitor too much, and we probably don't need to do as much as we thought we did. So there are a couple of things that I would remind everybody about. One thing we learned from this ProZinc study is that it takes a good 42 days, so 4 to 6 weeks, to really have an animal settle in and get the full benefits of insulin therapy. So we need to be patient. We need not to ask them to be perfect within the first 2 weeks. So I do not recommend running a lot of glucose curves for at least the first month that you're doing treatment on these pets. So give them the insulin, start them at a reasonable dose, monitor their clinical signs, make sure they're not getting hypoglycemic, and let them be and let them get used to insulin therapy. I do like to see the animals, every 1 to 2 weeks, and I like to see the owners. I like to make sure they have the right insulin and the right syringes, and they know how to do the injections, and the animals look okay. And I like to talk to them to make sure they're comfortable with what they're doing. But I don't make a lot of changes over the first month. I like to let them get used to their therapy. You're going to know you're giving enough insulin if their clinical signs are resolving, and hopefully you're going to be able to do some kind of spot check so you know that they're not getting hypoglycemic. And obviously people can look at their animals at home and seeing how they're doing. And then if after that time period we're not getting where we need to go, then we can start thinking about making major shifts in insulin, either dose or maybe having to change the type of insulin. The other thing I will say is we do know now that in-home or in-office glucose curves are probably not that helpful. And with the advent of continuous glucose monitoring, basically using the Freestyle interstitial glucose monitors, we can now put these on, send animals home, and get a much better idea about what their glucose control looks like at home. So let's say you have an owner who's never had a diabetic before and is very nervous about it, and they want to know what the animal is doing at home. And you're saying, oh, don't worry about it for the first couple of weeks, and they're worried. Put a Freestyle Libre on, send the dog home, and at least the owner has some way to watch this dog and make sure that they're not getting into too many problems with it. So the Libra can be helpful there. But again, for glucose curves, I think it's the most helpful to get the most information rather than getting in office glucose curves like we used to do. So one of the important things about monitoring diabetics is to make sure that they're not getting hypoglycemic or showing any sort of adverse responses to the medications that we're using, like we would with any kind of a medication that we use. But hypoglycemia, of course, is going to be a big problem with using an insulin product. So ways that we can do this are, of course, the most important thing is for owners to look at the clinical signs that their dog is exhibiting. So if it's getting really lethargic, or it starts to shake, or maybe doesn't get up and greet them when they come home, those are signs of hypoglycemia that, of course, the owner is going to want to recognize and maybe contact someone about. Certainly, if they can do spot checks at home, or they're getting spot checks of glucose at home, they can make sure that their pets are not getting hypoglycemic, and that can be really helpful. And again, using the Freestyle Libra continuous glucose monitoring, or the interstitial glucose monitoring that we have available, will certainly allow owners to pick up long periods of hypoglycemia at home and be able to either contact the veterinarian or be able to give the animal a high sugar containing, either like a solution like honey or syrup or something like that, to allow their blood glucose to normalize. And we need to mention that the most common adverse reactions to insulins are lethargy, anorexia, hypoglycemia, vomiting, seizures, shaking, diarrhea, and ataxia. And those are all going to be signs of hypoglycemia, which I think most of us will be able to recognize.
Yes, in my experience, the Freestyle Libre has really been a game changer as far as monitoring. And I was kind of laughing to myself when you said, well, if you tell the owner it's okay, but they're still worried, go ahead and put a Libre on. And I was like, the owner is worried. I'm worried. I'm the one that wants the Libre.
Yeah.
But I love that you brought that up, not to overmanage. I know I'm sure I've been guilty of this. And
Me too.
I could delve back into my history of diabetics I've managed, but I really don't want to, because I'm sure I'm in that boat. And
I know I've done it too. I think I've overmanaged them enough so the owners have given up, and it makes me sad when I think about it.
Yeah, absolutely. And it seems like there's a lot of what I feel like I'm hearing, both in this talk and on a lot of topics lately, is, stop worrying as much about the numbers. Of course, the numbers are important, but, more so watch your patient. And knowing that there aren't those same pathological endpoints in animals that we see in humans, like you mentioned, the retinal problems and the vascular problems and all of this, I think it gives us a lot more freedom to manage these guys and not overmanage them.
I couldn't agree more. And I do believe that many, and certainly there's going to be the tough animal that you really have to manage. But for many diabetics, they're pretty straightforward. We'll get them on some insulin. They really do fine. And I just want to make sure the owner continues therapy. Like they just hang in there with it. And, that the animal gets to live a happy and healthy life. So I think one of the things that we've learned over the past 10 to 15 years is that we've overmanaged many of our diabetic patients, and our focus should be really on just achieving our treatment goals. And the goals for successful insulin therapy include controlling clinical signs and returning the animal to a normal physique, so that they're well muscled and they're active and they want to run around. And we want to do those things, and while avoiding any sort of an emergency situation like hypoglycemia, hyperosmolality, or ketosis. We want to keep them out of the emergency room. So we want to avoid any of those emergency situations.
Well, Dr. Ward, this has been an amazing talk, and I think is just such an exciting viewpoint on managing diabetic dogs. I think it gives us a lot of flexibility to really do right by our patients and by pet owners, with the potential for once a day dosing and not over managing. So I want to thank you so much for joining me to go over all of this. Any final thoughts you want to share with us?
I'm first of all, thank you so much for having me. I love to talk about diabetes, and there's so much exciting research that's been coming out about how we're managing them. And then with ProZinc insulin as a once-a-day insulin, I think we have so many more tools for us to be able to really help our patients and our owners. So I'm so delighted that I got a chance to talk about it. And again, I'm hoping everybody out there will give ProZinc insulin once a day a try and see if it can work in your hands and make your owners' lives a little bit easier.
I love that. I love that. Well, thank you again, Dr. Ward. It was great having you.
Thank you.
And thank you to Boehringer Ingelheim Animal Health for sponsoring this edition of Vet2Vet. Check out the Spark section of vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. Important safety information. ProZinc, protamine zinc recombinant human insulin, is for use in dogs and cats only. Keep out of reach of children. Animals presenting with severe ketoacidosis, anorexia, lethargy, and/or vomiting should be stabilized with short-acting insulin and appropriate supportive therapy until their condition is stabilized. As with all insulin products, careful patient monitoring for hypoglycemia and hyperglycemia is essential to attain and maintain adequate glycemic control and to prevent associated complications. Overdose can result in profound hypoglycemia and death. The most common adverse reactions were lethargy, anorexia, hypoglycemia, vomiting, seizures, shaking, dogs only, diarrhea, and ataxia. Many of the adverse reactions, such as lethargy, seizures, shaking, and ataxia, are associated with hypoglycemia. Glucocorticoid and progestin use should be avoided. The safety and effectiveness of ProZinc in puppies, kittens, or breeding pregnant and lactating animals has not been evaluated. ProZinc is contraindicated during episodes of hypoglycemia and in animals sensitive to protamine zinc recombinant human insulin or any other ingredients in ProZinc. For full product information, please refer to the package insert.